Hello, my name is Lauren Lethko and I'm a student at South University. I'm pursuing my Master's in Science of Nursing as a family nurse practitioner. The role of the advanced practice nurse was my very first course in graduate school, and it's been a little while since I've done any sort of schooling. I graduated with my bachelor's 11 years ago. I've practiced as an emergency room nurse ever since and decided I don't have any reason not to go on to become an advanced practice nurse. Navigating through the course itself has been a learning experience, but I'm starting to beginning to get a feel for the online classroom. I do believe that I've learned a lot throughout this class. Before entering into the program, I didn't have a full understanding as to what the advanced practice nurse actually was or how it has evolved. I didn't understand where it came from. I didn't know any sort of historical significance to it. All I knew is that nurse practitioners function similarly to physician's assistants, but I couldn't differentiate it. And that they work underneath the doctor. And that's essentially it. I've learned a lot ever since then, and I'm excited to pursue my role as an advanced nurse practitioner. Within the realm of the advanced practice nurse, there are different roles and scopes of practice. There are both clinical and non-clinical roles. Clinical roles include the nurse practitioner, the certified nurse midwife, the certified registered nurse anesthetist. Non-clinical roles include education positions, nursing informatics, which are so important in building different technologies and health systems utilized by healthcare team members across the board. And of course, there's the health policy arena. Advanced practice nurses lobby for different state legislation and even nation legislation, which affects healthcare in general, as well as the practice of the other advanced practice nurses. Health promotion and disease prevention are key components in lowering the cost of healthcare. Let me explain. If we can prevent diseases from getting to the point where they basically keep patients from getting sicker by focusing on primary prevention, health promotion, education, quality improvements, things like that, then patients won't get sicker. Those costly treatments won't be necessary. Therefore, we won't be spending as much money as a nation if we're healthier. Research and theory promotes this idea, and it's been proven over and over. We need to increase access to health care, and we need to decrease costs. Collaboration amongst the healthcare team is imperative when looking out for the best interest of the patients. I believe that multiple ideas coming together are going to create the best course of treatment and the best plan. Nobody's an expert on every single thing. Collaboration is so important when it comes to taking care of patients, and not only taking care of patients, but starting to write healthcare legislation, coming up with policies, coming up with evidence-based practice. Evidence-based in itself is alluding to a collaboration. It's not just the studies of one person. It's something that can be replicated over and over and over. Leadership is also an important part of this. Being able to put everything together, to interpret data, to come up with a plan. Those are all very important keys in the advanced practice nurse, particularly with the family nurse practitioner, which is the degree with which I'm pursuing. My philosophy as a family nurse practitioner will center solely around the patient and the community. I believe in focusing on treating the patient rather than treating the disease. That includes collaborating with other team members and other different specialties, always looking out for the best interest of my patient. In hand with that, the patient is part of a community. Community is so important to the advanced nurse practitioner. Several years ago, my father, who is a family practitioner, a physician within the area, my father and I started a free medical clinic within our town. In evaluating our town, we realized there were no free medical clinics within the town of Somerville, South Carolina. The closest was downtown Charleston. And access to that was a huge problem for many of the people who lived in Somerville. It's several miles away. A lot of people didn't have transportation, and that clinic was already pretty overcrowded. In collaborating with my father as a nurse, we were able to come up with a practice, how we were going to approach things. We met once a week, every Monday night, and we served many, many families. This resource has become an invaluable place within our community. We are now a 501c3 nonprofit facility, and we also offer free medications. I believe that I need to move forward with this as an advanced practice nurse, as a nurse practitioner, to promote more different facilities, more programs like this, which will improve access to care and decrease health costs. If we can promote primary prevention with patients, then I believe that it will help our community overall. I look forward to becoming a family nurse practitioner, and I appreciate this class and everything that I've learned in it. Thank you very much, and have a good day.